All right, let's begin with the breaking news this hour. The President of the United States now at Walter Reed Military Hospital in Bethesda, Maryland. We understand he will be there for a few days, but we do not know the extent of his illness. We do know he has COVID-19. Trump and First Lady Melania Trump both tested positive for the coronavirus late yesterday. He is not the first world leader to get COVID-19, but at 74, he is the oldest. The CBC's Ellen Morrow joins me now live from Washington. Ellen, what's the latest?
Well, Carol, it's been an absolutely historic afternoon here in Washington, D.C. As you said, President Trump admitted a short time ago to Walter Reed Medical Center after testing positive for COVID-19. And just as he was leaving from President Trump's Twitter account, we had a video of the president. Here's that.
I want to thank everybody for the tremendous support. I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out. The First Lady is doing very well. So thank you very much. I appreciate it. I will never forget it. Thank you.
So the president there saying that he thinks he's doing very well on his way to Walter Reed Medical Center. That's the message we've kind of had from the White House throughout the day, that the president is fatigued, that he has mild symptoms, but he's overall in good spirits. We also had a memo from the physician to the president, Sean Conley, Dr. Sean Connolly, this afternoon. And in that, Conley said the president had a treatment today for the coronavirus. He was treated with an antibody cocktail as well as several supplements. But important to point out that we haven't had a huge amount of specifics from the White House on how exactly the president is feeling. You hear him there saying that he thinks he's doing very well. We've heard White House officials saying that he has mild symptoms but in good spirits. We don't have much more detail than that. In the midst of this really extraordinary and historic moment, there is reporting in U.S. media, CNN and the New York Times, citing unnamed sources that's more detailed on the symptoms. Those outlets saying the president has had a fever throughout the day, that he has a cough and congestion. But again, that's coming from U.S. media reporting. So it's hard to read into that without more specifics, but this is obviously historic. The president going to Walter Reed Medical Center after being diagnosed with COVID-19. The White House says it's out of an abundance of caution, that he'll be working while he is there. And again, we don't want to speculate about this, and that's the statement from the White House press secretary you're seeing there, out of an abundance of caution. We don't want to speculate, obviously, about how the president is feeling beyond that. But clearly there is enough going on with his symptoms, with how he's feeling, that the White House thought it necessary for him to go to Walter Reed for what we're being told will be a few days out of an abundance of caution.
What happens if the president gets too sick to work?
Well, that is a big question that was being asked throughout the day, and now especially being asked now that he is at Walter Reed. Again, important to point out, the White House says that he will be working, that this is a precaution. But again, that is a major question, particularly given the president's age. He's 74 years old. His weight category also puts him at higher risk. Earlier today, the news came out that Vice President Mike Pence has tested negative for the virus. He is doing well. He's working from his own residence. So that sort of allays some of the concerns about continuity of government. If there was a situation where President Trump was too sick to work, there is the 25th Amendment, and that sort of allows the president to hand over power temporarily, and it has been invoked several times for medical procedures like colonoscopies and things like that. And once a president is back to being able to work, they take that power back. So that's a possibility. Again, we don't want to speculate on that. No indication that that is something that is imminently going to happen. But again, these are questions that are being asked on this, really stunning day here in Washington.
Ellen, thank you. The CBC's Ellen Morrow in Washington. Joining me now is Todd Gilman. Todd is the Washington bureau chief for the Dallas Morning News. Todd was on Air Force One just a week ago. He was also at the debate in Cleveland. Todd is just outside Washington. He lives about a mile away from the Walter Reed Hospital, 1.8 kilometers for Canadians. Todd, first of all, Todd, how are you doing? I mean, has this had an effect on you?
My wife is a little worried, but I am zero worried. When I was on Air Force One a week ago, Hope Hicks was not there. I was not especially close to the president at any point. We were at a rally in Virginia with 5,000 of my closest friends. It was outdoors. It didn't feel especially unsafe. And I have not been in proximity to any of the people that are known to have COVID in the last few days. At the debate, as I'm sure you know, most journalists are not actually in the debate hall. We're in a workspace that's separate from that. And so I don't feel personally unsafe, but it's affecting everybody's lives. Everyone's worried. I know journalists who have tested positive in the last day. We had 3 members of the White House press corps. The White House has been a pretty risky place to work for journalists and for staff because the West Wing staff, taking their cue from the president, has really taken kind of a cavalier attitude towards all of the safety measures that we've heard from the CDC and the World Health Organization and everybody else about wearing masks and maintaining social distance.
Yeah, it was striking, the difference today if you look at what's going on in the White House, which I assume now is considered a COVID hotspot compared to a few days ago. No one was wearing masks. Now, tonight, everybody is wearing masks.
You know, almost all of the journalists have been wearing masks for months all the time when we're indoors. And all of the aides, young, older, have absolutely followed the cue from the president. They don't want to show weakness. The president has set a tone for months that he wants to project a sense of normalcy coming out of the White House. It's all under control. The coronavirus is subsiding. The economy can get back to normal. You can all go back to your jobs and restaurants. And it was a facade. And we all of the reasonable journalists who wanted to keep being able to go to work and report the news and hold the president and his team accountable, we knew that we needed to protect ourselves. We've been pretty forceful about reducing our footprint, the number of people in that very confined area. And there's, the press officer, the press secretary, Kayleigh McEnany. Every time she comes out to give a briefing, no mask. Every time the president comes out to give a briefing, no mask. And this is the fallout. People have been asking me all day, are you surprised that the president has developed COVID? I don't think anybody who has dealt with him in the past 7 months is surprised that he has developed COVID.
Todd, what do we know about the president's condition?
Well, we know that he spiked a fever today. Which is never a good sign, but is certainly predictable. He looked pretty good walking to Marine One within the past hour or so to take a quick flight to Walter Reed, which, as you say, is about 1.8 kilometers from me. He didn't look too bad. I would say he looked flushed. If I was looking at one of my kids, I would say, I want to feel your forehead. I think you've got a fever. He's taking a regimen that is pretty experimental, antibody treatment, which requires more robust monitoring than the White House medical unit can realistically provide. I wouldn't read too much into the fact that he has been hospitalized, other than the fact that he's taking an experimental treatment. He's 74 years old, which puts him in a high-risk category. He's obese, which puts him in a high-risk category. And he's the president of the United States, the most important person in government in the United States, and should be looked after as carefully as possible.
Yeah, we have an infectious disease doctor on standby to talk about his particular treatment so far. But what does all of this do to the campaign in the coming days, including the debates?
Oh, it upends the campaign. It is a terrible setback for President Trump. I know there's been a lot of speculation on social media and various circles that Trump was looking for any excuse to get out of the next debates. There's 12 days left until the next one is scheduled, 13 days in Miami. assuming the 14-day quarantine period. I'm not sure how he can make that appointment. But it's a terrible setback because President Trump has, first of all, his whole campaign approach to campaigning is based on presenting himself in front of large crowds. He feeds off of that energy. It builds enthusiasm. It projects enthusiasm. And he loves speaking at rally crowds. I mean, the man, he speaks for 90 minutes routinely, day after day after day in these crowds. He can't do that anymore. Secondly, the ability to go out and do that was part of his whole campaign pitch. I am in control. The coronavirus isn't so bad. That guy, Joe Biden, is such a chicken. He only goes out with a mask on. He won't speak in a room with more than 25 people. Well, Joe Biden can now rebut easily and say, yeah, I don't have these big crowds, but I don't have COVID-19 either. It is just a huge impediment to President Trump trying to get any message across to the American people in the next 30 days.
Joe Biden, for his part, has saying he is taking down all negative campaigning as of now.
Well, that's awfully nice of him. He gave a speech in Grand Rapids, Michigan this afternoon where he could have, but did not take off his mask for the entire time. He didn't say anything about President Trump other than, I wish him and the First Lady all the best, but keeping the mask on throughout the speech spoke volumes. It was, pure theater, probably for the best because Joe Biden is even older at 77, also at a high risk category. He doesn't have to go negative at this moment. He doesn't have to say the president has been stupid, foolish, idiotic for 7-8 months by downplaying the need for masks and social distancing. He doesn't have to say that because the president is in Walter Reed and Joe Biden is out there on the campaign trail.
Who makes the call, Todd? One quick question for you before I let you go. We don't have much time for it, but I want to get it in here. Who makes the call as to whether the president remains the president while he's ill or somebody else needs to take over, the vice president?
That, I'm not sure, is a very quick answer, but we have a 25th Amendment to the Constitution, which lays out all of the particulars. It is possible for the president to sign a piece of paper and voluntarily say, I'm going into surgery under general anesthesia for the next 4 hours, or until I come out of anesthesia, the vice president is acting president. He can do that. Also, the vice president, with the consent of a majority of the cabinet, can sign a piece of paper and say, we invoke the 25th Amendment. We believe that the president is incapacitated. And then there are procedures for the president to petition to have his powers restored to him if the cabinet doesn't consent when he wants that to happen. If the president is comatose for some period of time, if he were to die, then obviously there's an automatic transition of presidential authority.
Yeah, ventilation, I guess, would fall under that as well. If he were to be on ventilation, then this would all kick in. All right, Todd Gilman, the Washington bureau chief for the Dallas Morning News. Todd, pleasure to talk to you. Thank you.
Sure, happy to do it.
All right, let's talk about the medical side of this. How do doctors treat a case like the U.S. president's? My next guest sees COVID-19 patients firsthand. He knows about those kinds of treatment plans. He's a familiar face in our program. Dr. Zane Chegla is an infectious diseases physician and medical director of infection control at St. Joseph's Healthcare in Hamilton. Dr. Chegla, what was your reaction when you heard that the president had been essentially medevaced on Marine One to Walter Reed Hospital?
Yeah, I mean, it's unfortunate. I think I wish him a well recovery. I think they're doing this more out of an abundance of caution. Seeing that he's just been diagnosed actually looked relatively reasonable during the debate a couple of days ago. I would suspect this is again more for the sake of monitoring than it is actually for a medical complication at this point.
Why do you say that?
Usually the disease, the first couple of days of symptoms, people aren't particularly ill. They have their fever, a bit of shortness of breath. It usually, when people develop kind of the major complications, they're a few days into their illness typically. And so, he's right at the beginning of his illness. It seems like, at least based on the news and his appearances in the public. And so, I think theoretically he's just, again, at that peak, rather than, kind of at the real needing to be hospitalized standpoint.
Yeah, the interesting thing is you contrast this with Boris Johnson, and, it can go very quickly. It can get bad very quickly, correct?
Yeah, I mean, Johnson, I think, had a very natural history syndrome in the sense that he was at home ill for a few days and then had to be hospitalized as things got worse, which is what we would expect for people if they go down that line of complications. President Trump has really been hospitalized very early in this process, again, suggesting that this is more just an abundance of caution rather than a true need for hospitalization.
He's got a couple of big risk factors.
So his age, number one, and so people at the age of 74, 75, risk of death with COVID-19 is about 5%. Risk of true hospitalization, i.e. for the reasons like Johnson was hospitalized, is about 12%. So, certainly there are some cards against him, but that's still, if you look at it at the other side of the coin, there's a good 95% chance he survives this, and probably a 90% chance he doesn't really need serious hospitalization or medical interventions.
We got the memorandum from Sean Connolly, the physician of the president and commander in the U.S. Navy, and we had a look at how the president is being treated by the president's physician. Let's take a look at that. I'll bring it up on the board. A single 8-gram dose of Regeneron's polyclonal antibody cocktail. What is that? And correct my pronunciation.
This is a company is called Regeneron, and so they have produced a synthetic antibody cocktail. So antibodies are the proteins in our blood that fight infection that we naturally make. So this is a company that's made synthetic antibodies. It's still in clinical trials. The best data that I think that's come out in the last couple of days is a small clinical trial of 270 individuals where they had some success with symptom resolution when giving this cocktail. It's still very experimental. So he got this more to see if they could boost his immune response to the virus. Again, this is not something we would technically give. This is probably a drug that's never been given outside of a clinical trial. But clearly, this is a different person in that status in the U.S. House. And
are there effective things that he could be treated with, Zane? Effective things that he could be treated with that he would only be able to get in the hospital?
Yeah, so we have an antiviral drug called remdesivir, which is given. The best evidence suggests it's really most effective in patients that are hospitalized, requiring oxygen rather than just the typical patient. But it's really never been studied. There are clinical trials for people really this early in this course, which is very difficult to do. And then the other thing is once he develops oxygen issues, if he does develop it, then steroids are the other treatment. And that one has probably the best evidence out there of having significant effects, both for relieving symptoms and increasing survival in these patients.
All right. Zinc, vitamin D, famotidine, melatonin, and a daily aspirin. What does that tell you about how they're treating this?
Yeah, aspirin, I think he was taking this beforehand for just cardiac protection. Famotidine is a drug called Pepcid, which you can get over the counter for heartburn, but there's very, very unclear data of its effects in COVID-19. And then zinc has been a very controversial drug associated with hydroxychloroquine in the treatment of COVID-19, where most data has suggested it hasn't really had much effect. And vitamin D, there's a hypothesis around vitamin D in COVID-19. Most of the data doesn't suggest it's worth any effect, but these are relatively benign therapies, and I guess they're just giving it to him for the sake of giving it to him at that point.
Okay, so take us through what to look for in the coming days, hours and days.
Yeah, so typically people kind of suffer with the symptoms for a couple of days, and really in the hospitals, we notice day 3, 4, and 5 is where after symptoms come on, where people either deteriorate or they kind of improve at that point and then kind of have a one-way approval after that. So again, today is probably very early to see it if this is truly the day or the day after his first onset of symptoms. I would say probably day 3, 4, or 5, you're probably going to see what the end result of this is, if he's going to recover or if he's going to need more intensive therapy.
There has been discussion that he looked tired, he was very lethargic in the last couple of days. Could it be that he was experiencing symptoms of COVID-19 and did not recognize them?
Yeah, absolutely. I mean, I think the prodromal symptoms are very, they mimic other things. They mimic sleep deprivation. They mimic just a typical headache. He's obviously had a very busy schedule with everything that's been going on with the U.S. election. And so one may minimize those symptoms and really kind of this seemed to be triggered by an exposure and some cases showing up at the White House where, again, he may have had some of those minimal symptoms that he's been kind of dealing with.
All right. Zane Chegla, thank you so much for joining us tonight. And we'll speak to you, Dr. Chegla, in the next hour.
Absolutely. Take care.
Prime Minister Justin Trudeau extended his best wishes to the U.S. President and the First Lady. In doing so, he made a reference to his wife's COVID-19 diagnosis in March.
When I woke up this morning, I was apprised by my team that the President and the First Lady had tested positive. Of course, my first thoughts are in support of them, and I hope for a speedy recovery. They had certainly reached out when Sophie got her diagnosis earlier in the spring.
Meanwhile, a mix of condolences, well wishes, and undisguised glee echoed across Canada and around the world. Sarah Galashan has been gathering that for us. She joins me now. Sarah.
The floor to the Conservative leader, Aaron O'Toole, who, along with his wife, Rebecca, tested positive for coronavirus and really only has just emerged from isolation. He tweeted, Rebecca and I know firsthand the challenges of COVID-19 and wish at POTUS and FLOTUS a speedy recovery. Also, NDP leader Jagmeet Singh issuing a statement that reads, I wish a speedy recovery for the President and the First Lady. No one deserves to get sick. This virus has needlessly cost many lives. We can all do our part to protect ourselves and each other. Listen to public health officials, wear a mask. So well wishes there, but also taking an opportunity to point out the effectiveness of wearing a mask, which we know, and you pointed at this already this hour, Carol, that President Trump has refused to wear a mask whenever possible.
Sarah, Donald Trump announced his illness on Twitter early this morning, and reaction on that social media platform was swift.
It was. The hashtag Pray for Trump is being used. It's trending, and it's being used both by those who are offering well wishes and those who are most certainly not offering well wishes to President Trump. There's a lot of mean-spirited joking going on that platform right now. The Italian far-right leader actually talked about those jokesters today. He addressed the kinds of jokes that he's seeing and called people who would make jokes at the expense of someone's health. He called those people disgusting. And there was an interesting tweet from the editor of China's state-owned newspaper Global Times. I want to read it to you. It reads, President Trump and the First Lady have paid the price for his gamble to play down the COVID-19. Now, I say this is interesting because it was initially reported by the Associated Press. We've gone back on Twitter and there's no sign of it now. Of course, Trump often blames China for coronavirus. The paper is state-owned, and the state itself, China, has not been quick to comment on President Trump's illness. Vladimir Putin reaching out directly with a message and public, and that message is, I hope that your inherent vitality, good spirits, and optimism will help you cope with the dangerous virus. And finally, a rather gracious tweet actually coming from the director of the World Health Organization, and it reads, my best wishes to President at real Donald Trump and FLOTUS for a full and speedy recovery. Of course, Trump has announced that the U.S. is going to be withdrawing from the WHO and taking his money with it. The WHO, he says, is too heavily influenced by China. Carol?
All right, Sarah, thank you.
You bet.